Did you ever visit your mom or dad and find out that they were on a whole shoebox of medications? Did you ever worry if they were taking their medications correctly? If so, stay tuned for the next 10 minutes or so because this video will help you. My name is Dr. Thomas Young, and I've been practicing internal medicine for over 30 years. Over that time, I've found that elderly patients and their families don't know enough about the medications that they're taking. This lack of knowledge can lead to confusion and even harm to the patient. Our elderly parents are often prescribed 5 or more medications. The term for this is polypharmacy. As the number of medications increases, so does the chance for drug interactions, or what I call medical misadventures. Having specific knowledge about their medications will give you the best opportunity to avoid mistakes and improve the health of the patient. Here are 10 things your doctor wished you knew about your medication. All comments in this presentation are for informational purposes only. They do not constitute medical advice and should not be construed as medical advice. You should never change your medication regimen without checking with your physician. Point number 1. Every medication has 3 different names. The brand name, which is assigned by the company that first develops and manufactures the medication. The generic name, which is used when the patent expires and the drug can then be sold by several manufacturers, causing the price to come down significantly. And the chemical name, which is how a chemist would describe the substance. You should learn the brand name and the generic name of every medication that you're taking. Often the brand name is used by doctors and nurses, even though the patient is getting the generic formulation simply because it's easier to remember and spell, but knowing the generic name is important as well. As an example, you can see that a common medication for high blood pressure goes by the brand name Norvasc, and the generic name is amlodipine mesylate. Norvasc lost its patent protection many years ago, so now there are multiple pharmaceutical companies who produce amlodipine mesylate. At the top of the slide, you can see the chemical name of amlodipine mesylate. You can see why no one would use this lengthy term in ordinary conversation. Also pictured here is the chemical structure. Here are a couple of other examples. The generic name of brand Lipitor, a commonly used cholesterol medication, is atorvastatin calcium. The generic name of Voltaren, an arthritis medicine, is diclofenac sodium. Point number 2. Medications in the same class usually have similar endings to their generic names. For example, you may have heard that the statin medications are commonly used to treat high cholesterol and prevent heart attacks. Every medication in this class ends in statin. For example, atorvastatin is the generic name of Lipitor, rosuvastatin is the generic name of Crestor, pravastatin is the generic name of Pravachol, and simvastatin is the generic name for Zocor. All of the statins are now available as generic formulations, but you will still hear of them being referred to by their brand names from time to time. I recently ran into a patient who was taking 2 statins by mistake. He didn't know that they were in the same class, and none of his prescribing physicians caught the mistake either. This just demonstrates the point that patients need to pay attention to these details for their own safety. Point number 3. Similar medications can have similar beginnings to their generic names. When a medication loses its patent protection, the drug companies will sometimes chemically alter the medication so that a new formulation is made. This formulation is often touted as being more effective or having fewer side effects. A short prefix is then added to the name of the original medication, and the new medication receives a new patent. For example, omeprazole, or brand Prilosec, was chemically altered to a slightly different molecule and was named esomeprazole, or brand Nexium. Both of these medications are used to treat acid reflux, and they can be considered interchangeable. Another example is the antidepressant medication venlafaxine, which is brand name Effexor. The drug company refined the molecule by modifying it slightly, and the resultant medication desvenlafaxine or prescribe was reported to cause fewer side effects. Point number 4. Medications are sometimes produced in both short-acting and long-acting formulations, and it is important to know which one a patient is taking. Usually the long-acting formulations only have to be taken once a day, which makes it much more convenient. When a drug is formulated as long-acting, a suffix is added, usually XR, XL, or ER, which stands for extended release. Here are two examples. Metformin is a medication used to treat diabetes. It's been around for many years. The short-acting formulation needs to be taken twice a day with meals to adequately control your blood sugar. It also comes in a long-acting formulation, and some diabetics only need to take this pill once a day, which is more convenient and improves compliance. A similar example can be found with the antidepressant venlafaxine. It too comes in both a long-acting once-daily formulation and a shorter-acting twice-a-day formulation. If you are prescribed this medication and you're not sure which one you're taking, your medication effect could wear off before the next dose. Point number 5. Generic medications have both a first name and a last name. Here are some common examples. As we mentioned previously, the generic name for the cholesterol medication Lipitor is atorvastatin calcium. Sometimes patients may question if they should take this, especially if they're on a low calcium diet to prevent kidney stones. The amount of calcium in the tablet is negligible, so it can be taken safely. Another example is the generic name for Voltaren, which is diclofenac sodium. Patients who are on a low sodium diet may be fearful of this medication, but again, the amount of sodium in the tablet is negligible and does not add that much to a person's sodium intake. You may be wondering if you need to remember both the first and last name of each medication you're taking. In the vast majority of cases, only the first part of the generic name is used. However, there is one medication that is an important exception to this general rule. There is a common heart and blood pressure medication called metoprolol, and it comes in two different formulations. Metoprolol tartrate, which is short-acting and carries the brand name of Lopressor, and metoprolol succinate, which is long-acting and goes by the brand name of Toprol XL. The XL stands for extended release. So Toprol XL is only taken once a day. Point number 6. The time of day that you take your medications may be important in some cases. It's always a good idea to ask your doctor or pharmacist if this is the case. For example, Fosamax or alendronate, a medication taken to treat osteoporosis or low bone density, should be taken on an empty stomach because any food in the stomach will block the absorption of the medication. On the other hand, some medications such as naproxen or generic naproxen should be taken with food in order to avoid an upset stomach. Your doctor or pharmacist should be able to tell you if a medication should be taken on a full or empty stomach. With some medications, the timing of the dose can be important for other reasons. For example, the diabetes pill repaglinide or Prandin is taken at mealtime because this medication works to lower blood sugar quickly and thus prevents the spike in blood sugar that occurs after every meal. If a diabetic takes this medication without eating, they will likely develop hypoglycemia, a low blood sugar that could be potentially dangerous. Some medications, such as mirtazapine or Remeron, are taken at night because they tend to cause sedation or sleepiness. Obviously, taking a sedating medication right before you go to sleep is one way to avoid the effects of feeling too sleepy during the daytime hours. Point number 7. Perhaps you've gotten a pill bottle from the pharmacy and found a large folded up wad of paper attached to the bottle, as shown here by the arrows. This paper is called a product insert, and the FDA requires that this information be provided with every pill bottle that leaves the factory. This document provides an extremely detailed description of the medication that is primarily directed at the physician. Many times there is a section specifically written for patients that summarizes how the medication should be taken, along with potential side effects and other safety concerns. It is worthwhile to take a look at this document if it's provided to you. The product insert sometimes contains an important statement from the FDA called a black box warning. A black box warning is issued by the FDA when the medication can have a very serious potential side effect that requires extra caution on the part of the prescribing physician. And this warning is literally surrounded by a black box, as shown here. Point number 8. You may have heard the term off-label use. This term is used when a physician prescribes a medication that does not have official FDA approval for that particular use. For example, gabapentin or brand Neurontin is a seizure medication that is also FDA approved for postherpetic neuralgia, which is the stinging, burning pain often felt with a case of shingles. Gabapentin is also helpful for other types of nerve pain, although it never received FDA approval for the treatment of other types of nerve pain. Nonetheless, it is commonly prescribed for treatment of nerve pain and can be very effective. Off-label prescribing is perfectly legal. It is estimated that up to 20% of prescriptions are prescribed for off-label use. Point number 9. Why are prescription drugs so expensive? Under our capitalistic society, of course, the manufacturer of a product will decide how much they want to charge for their products. The cost of research and development of new medications is substantial. In fact, it takes 10 to 15 years at a cost of $1.4 to $2.6 billion for a medication to be successfully introduced to the marketplace. Ultimately, only about 10% of drugs that undergo extensive testing and studies ever make it to the marketplace. Thus, pharmaceutical companies ultimately spend a lot of money studying compounds and formulations that never make it to the market. Point number 10. How do doctors decide which medication to use on an individual patient? There are, after all, multiple things to consider when prescribing a medication. Prominent sources of medical information for practicing physicians include treatment guidelines issued by medical specialty societies, such as the American Heart Association, the National Kidney Foundation, and others. These organizations will publish periodic guidelines about how certain medical conditions should be optimally treated. This information is likely one of the largest contributing factors determining what your physician will recommend. Of course, your doctor will also apply his or her own experiences in the past and obtain opinions from other colleagues, along with keeping up to date with medical journals. Other factors weighed in any treatment decision include the cost of the medication, which potential side effects may be likely, and also the patient preferences. So if you have concerns about what your doctor is prescribing, don't hesitate to let them know, as there may be alternate medications available. You may have heard the common phrase, knowledge is power, and in the case of medical treatment, the more knowledge you can obtain about your medications, the more power you will have in your own health care and the care of your loved ones. If you found this presentation helpful, please like this video. I would also encourage you to share this video link with your family and friends, especially those people who are on multiple medications and perhaps confused about them. I am also offering 1-hour personalized online or telephone educational sessions in which I provide specific education about an individual's medication list in some detail, going over the indications for use, common side effects, and other important information. Family members and caregivers may find this session extremely valuable in order to keep their loved ones safe. You can find out more about this service by visiting my website, www.medicationknowledgeforsafety.com, or by scanning the QR code on the screen. Thank you for your attention.